everyone, in this video we want to discuss the management of constipation during pregnancy. What are the best approaches for the treatment of constipation? The best approach is to increase the amount of fiber in daily food, like increasing vegetables and fruit. In the case of pharmacotherapy, psyllium, a bulk forming laxative, is actually the best and the safest option that can be used. In the case of resistance to this option, magnesium hydroxide can be used safely. In the case of resistance to magnesium hydroxide, lactulose and bisacodyl can be used. They haven't studied during pregnancy, however, according to their low systemic absorption, they can be considered safe. Castor oil should be avoided during pregnancy because of the induction of uterine contractions and also interfering with the absorption of lipid-soluble vitamins like vitamin A, vitamin E, vitamin D, and vitamin K. So, psyllium, the best option. Magnesium hydroxide is also safe. Lactulose and bisacodyl, in the case of resistance to these options, can be considered safe. They haven't been studied during pregnancy. Castor oil should be avoided. Hope you enjoyed this video. Please like, subscribe, and share. And don't forget to ask your questions in the comments. Thanks.